The Lipotrim programme was set up for general practice, and it's been running in general practice for over 20 years now. But over the years it has, the demands on general practice are getting more, and GPs don't really have the time for weight management because it's a long-term chronic problem. So it was on the suggestion of GP think tanks. We had several meetings with local GPs, and they suggested using pharmacists because we do have the medical control and the pharmacists have the time and the availability so that patients can see them in the community long term. Lipotrim is food. It's enriched skim milk, so it's food, but it's based on the concept of enteral feeds. I mean, people have been using enteral feeds in the medical field for patients from birth to death for decades now. So basically what Lipotrim is a nutrient-complete enteral feed, but without all the extra calories in. So it's not just about losing weight. I mean, people have to understand that's the important bit, to lose weight, but long term you have to make changes to keep that weight off. So we have a programme where they refeed back to appropriate food, and then there's a long-term maintenance programme. And obviously because we run the programme in pharmacies, they're able to attend long-term, they've got local access in the community, fits in with their timing to be able to go. Weight loss is actually the easiest part of any programme. People know how to lose weight. You can talk to anybody, they can lose weight by lots of different means. The main problem is weight maintenance. People don't learn to change and don't learn to keep the weight off. Historically, if you look at a group of dieters, 95 out of every 100 dieters who've managed to lose weight by any method, after the first year, they've put all that weight back on again. And if you look at those statistics again, in 5 years, everybody's put the weight back on. So it's not how you lose the weight that's important, it's what you do long term. So at Lipotrim, we've addressed this. So we've made availability of the maintenance formula for people to use. We've made access to community pharmacies so they've got long-term support. And that's the key to it. So there's lots of things you have to look at for maintenance. There's portion sizes, there's where the calories come in food, and most importantly, when you've been overweight, there's the insulin resistance problem where you've got to learn to control that appetite, which we do with the soluble fibre in the maintenance formula, so that you get more control over your hunger between meals, so you learn not to snack. Well, the most important part of the product is the soluble fibre. What that does in the body is soluble fibre, when it gets into the gut, it slows the absorption of sugar from the gut into the bloodstream. And that has an effect on our hormone insulin, which is there to control the rise and fall in our blood sugar, which consequently affects our appetite. So it's very important to get soluble fibre into the system when we're learning to eat less. When you use soluble fibre, it does lower the glycemic index of the entire amount of food that you're eating. So it's a long-term benefit for people to use the maintenance products to help them control. It's all to do with blood sugar control. If you eat simple sugars, fruits, white bread, these types of things, they're normal healthy foods, they're part of a normal diet, but they do have a high glycemic index, they lift the blood sugar very quickly, and that's what causes people a lot of appetite problems. The maintenance formula does have all the vitamins and minerals in it as well, and all the trace elements, the same formula we use in the diet programme, so that when people might be eating less while they're learning to maintain their weight, we know they're well nourished while they're doing it. So it's not just a case of giving them some fibre. We do have to think about people's long-term nutritional profile. So if you want to maintain your weight, you may just need a maintenance formula for breakfast every day. That helps keep the blood sugar very level during the morning. Don't snack mid-morning, because we're teaching people to learn to eat 3 meals a day and not to snack in between. Wait until lunchtime, a proper healthy low-fat lunch, and then wait in the evening to a normal evening meal. Now, some people might find that quite difficult and still struggle with their appetite. Say people who've lost 5 or 6 stone, they've got a bigger problem. They may need to use another maintenance formula at lunchtime as well. So have one for breakfast, have one at lunchtime with some food. They may make the vegetable soup for lunch, add some more vegetables to it, put some more flavouring in it, eat a nice brown bread roll with it, have a yoghurt. That would be a nice lunch for someone, and then wait until the evening time to have a proper healthy eating evening meal. That would be good for maintenance for lots of people. And then other people want to still lose weight but find the idea of the strict Lipotrim program quite difficult. What we'd suggest for those patients is to perhaps have 2 of the maintenance forms with just a small amount of food with them, just a light snack, and then just 1 normal healthy meal in the evening. And a lot of people have lost a lot of weight doing that. You can eat food, I mean you'll be back to normal ordinary food, but obviously you can't eat as much as you ate before. So part of the programme is to learn about having smaller portions and eating less. Using the maintenance formulas allow you to learn that, and they're available long term, but you don't have to use them forever. You can do it with ordinary healthy eating, which is the ideal, and where most of us go wrong is in portion sizes. I mean everything we buy in the supermarket comes in larger packs. I mean there's no such thing as a sort of normal size bag of crisps and all this snack food, much bigger packets than it ever used to be, and we treat those as normal sizes now, and actually they're quite a bit bigger. So we want people to be aware of that. We give them lots of information, practical information about in the supermarket, foods they're buying, and of course they do have the formula to fall back on long term, but you don't have to use it all the time continuously. Men's health is, quite neglected in the field, and men are very poor about accessing services in general practice and pharmacy, and we do try to encourage the pharmacists to be proactive towards men's health. We would say about 20% of the patients on the programme are men, and we see a lot of professional men come forward because obviously they're in jobs where their weight can be an issue. We have ambulance drivers, firemen, they're on a busy schedule. I mean obviously firemen are climbing into buildings, so they do need to make sure they keep their weight under control. We have different types of diabetics, so we have to be careful that we've made sure we've picked that up on their screening forms. We have the type 2 diabetics who don't take any medication at all, and they're classed as diet-controlled diabetics, and they have no problems whatsoever. They can join the programme, and what will stop their diabetes getting out of control and needing medication is weight loss. So it's absolutely ideal for those diabetics to go straight on the programme. We do have insulin-dependent diabetics, which is type 1 diabetes, but we don't see them on the programme in the pharmacy. So, and even some general practices don't want to see type 1 diabetics. We usually leave that for the diabetic specialist clinic to look after them because there's a lot more considerations when people are using insulin. We have type 2 diabetics in the pharmacy who are on medication, but that is done closely in conjunction with their own GPs. And it's the GP's responsibility to stop the patient's diabetic medication before they start the diet. Because what happens when you're using the formula, the blood sugar will fall to normal very quickly and the patients don't need their diabetic drugs. And they must be stopped or that will cause them a problem. And this is monitored through the pharmacy and through the patient's own GP. We work with health professionals all the time with the programme. You can only be seen with a GP or a pharmacist. And what will happen is the patients will need their blood pressure checked more often if they're taking antihypertensive medication. And what we suggest is that can be done in the pharmacy because lots of pharmacies are able to check the blood pressure, or they would have to make arrangements with their own GP or nurse to have their blood pressure checked more often while they're on the diet. Now, sometimes in some very busy practices, they're not able to offer this service. So it's ideal if the pharmacist can do that, but there might be some situations where the pharmacist is not able to do the blood pressure checks, or the GP for that matter, and in that instance that patient wouldn't be allowed on the programme because we must have those blood pressure checks in place. And what often happens is you see a lot of very overweight people, their high blood pressure is weight related. It is because they're overweight, and simply by losing a stone or more can get their blood pressure down to normal, which is a fantastic long-term benefit when you think about the risk of stroke and long-term heart disease. If we can normalise that blood pressure for someone, that's really good long-term.